Thank you, everyone, for being here today. We have a lot of people jumping on still. Thank you all for being here. We'll give it just one more minute. All right, we will get started with our webinar today on inside vaccines, ingredients, development, and safety. My name is Mary Lizakowski, and I'm a Coalition Health Director with Foundation for a Healthy North Dakota. We are a nonprofit organization established in 2022 with a mission to promote health and wellness across North Dakota by working at the community level. We are continuing to grow our statewide coalition that will enable local communities to collaborate and work together on common initiatives. By becoming a member of the coalition, you will be the first to receive information about educational opportunities such as this one, updates on relevant public health information, legislative news, as well as access to digital advocacy resources and toolkits. Just a couple things to cover before we begin. Webinar attendees will be automatically muted for the presentation. If you have questions, please put them in the chat box. We are recording the presentation and will leave time at the end to answer any questions. And after the presentation, a link to the recording will be sent out along with an evaluation survey to complete. It is my pleasure to introduce our presenter. Dr. Ryan Hassan is a pediatrician in Happy Valley, Oregon, and the medical director of Boost Oregon, a nonprofit organization dedicated to helping families make evidence-based decisions about vaccines. As Boost Oregon's medical director, Dr. Hassan hosts community workshops for parents to learn about vaccines and educational workshops for healthcare providers and community health workers to discuss how to promote vaccine confidence. Thank you, Dr. Hassan, and I will turn it over to you to begin your presentation.
Thanks very much. Thanks for having me today. It's great to be here. Let me share my slides here. Okay. Hang on. I think I'm sorry. Doesn't seem like it's. Is this working properly? I think I'm showing my notes here.
Yeah, I think, yeah, you are showing the notes.
Hang on. Let me change that. How is that? There we go.
Yep, wonderful.
Great. Okay. Well, nice to be here, everyone. My name is Dr. Ryan Hassan. I'm the medical director of Boost Oregon and pediatrician practicing at outpatient clinic in my town in Clackamas. So I'm going to talk today about vaccines. First off, a little bit about Boost Oregon. Again, that's the nonprofit I work for. So we are a parent-led independent nonprofit organization. Our goal is to help people make science-based vaccine decisions for themselves and their families. We try to make sure we are providing education that is accessible to everyone who needs it, answering people's questions, providing safe and non-judgmental spaces where people can come with whatever concerns they have, and have respectful conversations about them and get their questions answered. And our goal is to help bring about a world where people's health decisions are rooted in science. So ways that we do that, we bring people together to support vaccine confidence in community workshops like this one and in-person events when we can, to just allow the opportunity to talk about vaccines, ask questions about vaccines, and just educate about the data behind them, their safety, things like that. And that's what we'll be covering today. Boost Oregon also does healthcare training, so we help other healthcare providers learn about how to have effective conversations about vaccines, and a lot of that is focused on basic things like kindness and appropriate communication. So we're helping parents feel comfortable having conversations and not feeling like they're going to be judged if they have questions or concerns about vaccines. And then we have materials that we provide for both for people in the community who want to learn about vaccines and for care providers who want to share information with their community. So today, my goal is to try and go through some of what I think is some of the most important information about vaccines regarding their safety, why we use them, why we need them, how they work, and how we know they work, and how they're monitored. I want to review the common vaccine side effects and provide hopefully a useful perspective and some helpful frameworks for thinking about making decisions for yourselves and your loved ones regarding vaccines. So my goal here is to hopefully answer common questions that many of you might have. I'm not here to change anyone's mind about vaccines. I'm not here to argue or debate about vaccines. If you have already decided I don't want to do any vaccines ever, that's fine. I'm not interested in having an argument. I'm here to just hopefully answer any questions that anyone has. And so if there's anything that you want to know about vaccines that I don't cover in the talk, please feel free to drop it in the chat, and I'll hopefully have some time at the end to address that. So first question I think we should answer is, are vaccines really necessary? I think that's one of the most common questions I get about, sometimes about sometimes about specific vaccines. Like, hey, do we really need these now? Like, are these diseases even around? Short answer is yes. Yes, we do need them. Um, so this graph on the left shows the annual disease cases of vaccine preventable diseases in the 1900s, early 1900s, and you can see there's a lot. There's half a million cases of measles a year. And 50,000 smallpox cases a year, pertussis all the time. Like people were just getting sick all the time. And back in the early 1900s, people were dying rapidly from these. These days, people don't die from these as much, but they still cause a lot of discomfort, hospitalization, and complications. But then, as of 1998, those disease rates had dropped precipitously, as you can see on the graph on the right here, where smallpox is gone, polio is totally gone, tetanus and diphtheria almost completely gone, barely any measles. Pertussis was the only one that was still, we were seeing a good amount, but it was only 6,000 cases a year instead of 150,000. And CRS here stands for congenital rubella syndrome, which is when a baby would get rubella from their mother at birth, and that would cause all sorts of very awful conditions. So that's why we need vaccines, why we use vaccines, why these were developed, because these diseases were scourges for kids and hospitalized and killed people every single year. And now it just is not nearly as much of a problem. So if we graph these diseases over time, you can see very clearly that as soon as a vaccine is introduced, that's when the disease rates drop. A lot of popular piece of anti-vaccine propaganda is a graph that shows death rates dropping from things like measles well before the vaccine was licensed. And it's a classic case of not all the information being presented. As I said earlier, like people weren't dying of measles by 1940s, 1950s because we knew how to keep people alive, but they were still getting very sick, which is what this graph shows. People were getting sick every single year, and those rates weren't changing at all until 1960s, and the vaccine was licensed, and then there's no more measles. It goes away completely. This graph shows Haemophilus influenza type B, which was a common cause for ear infections, meningitis infections on the brain, sepsis, blood infections. Kids were commonly getting lumbar punctures and antibiotics for this all the time. And then we start vaccinating and disease rates drop. And once we started vaccinating at 2 months, we just rarely ever see this disease anymore, except rarely in kiddos who are unvaccinated. Polio, same thing. This was keeping kids from even wanting to go swimming in the summers. Parents were terrified their kids would get polio. FDR famously had polio, and eventually that played a role in his early death. And then after a lot of collaboration and extensive research, we developed that in 1953, and then there's no more polio. And it was completely eradicated from the US for decades until we had a breakthrough case just a couple of summers ago. Um, Pertussis, same thing. Pertussis was causing whooping cough, 100-day cough, kids being hospitalized for this all the time. And then we licensed a vaccine and it just goes away. I've been fortunate to only see two cases of pertussis in my life, one from a kiddo who got it from their unvaccinated dad, and another from a kiddo who was too young to be vaccinated and got it from the other kiddo. COVID, same thing. I'm sure we all remember the early 2020s when this pandemic started to ravage the whole world. The US had some of the worst infection prevention policies, and I think we had something like a quarter of global cases and a fifth of global deaths, just way more than we should have. Um, and you can see here, this is straight from the CDC. These are cases in the US over time. And you can see the top bar is that this black bar shows unvaccinated disease rates versus this dashed line, this dashed blue line underneath it is people who had been vaccinated with the primary series who got almost no, no, this is death rates, not disease rates. So almost no deaths from COVID for people who were vaccinated. And then, of course, people who got that booster dose had even fewer deaths than that. So again, this is why these vaccines are necessary. We have very clear data showing it makes a big impact on how much people are getting sick, how much people are getting hospitalized, how much people are dying. And then last graph for you here, or image for you, is flu. Um, Flu is causing millions of illnesses every year, thousands, tens of thousands of hospitalizations, and thousands of deaths. And that's because about only half the country gets a flu vaccine every year. So I showed you how these disease rates have changed over time thanks to vaccines, but it still leaves a question, do we still need them now? And the answer is yes, we definitely do. Um, you may remember the graph I showed you before is from 1998. This one is a graph from 2019, and all of the diseases that were gone have now become more prevalent than they were, with the exception, thankfully, of smallpox, which we've eradicated, so we're not going to see anymore, and polio, which thankfully did not spread beyond that one case a couple years ago. But we have mumps, pertussis, Haemophilus, measles every single year. There's a measles outbreak in Oregon right now, and it's exclusively because vaccination rates have dropped. Meanwhile, flu is still killing tens of thousands of Americans every year, and between 100 to 200 kids a year, and almost exclusively unvaccinated, if not entirely unvaccinated. So that's why I would tell you that vaccines. So the next question to answer is, how do they work? Which I think is really important because I don't think a lot of people fully understand how they work, but it's actually quite simple and I think really cool to know how they work. And it's much easier to understand than any other medicine. I mean, don't really fully understand how a lot of medicines work. Like I can't really tell you much about how Tylenol works. It acts on a receptor in the brain to mediate pain, but I can't go much more detail than that. But vaccines are really straightforward. So I'll go through that briefly here. So starting out with, this is a depiction of our immune system. The job of the immune system is to protect against harmful germs like bacteria and viruses. And it does that by finding germs in our body and creating what are called antigens to them, or antibodies to them, proteins that bind onto these parts of these germs and allow our body to recognize them and destroy them. So the way that happens is we get infected by a germ, and this picture shows a picture of a virus um, uh, getting into a human cell and replicating and causing a bunch of new viruses to form. Our body sees those viruses, those germs, and it sends out a bunch of antibodies to try and attach to it so uh, it can lock it down and get rid of it. And it creates a bunch of different antibodies, and whichever antibodies work the best get made more of. And then eventually, usually after about a couple of weeks, our body figures out what antibody is needed to identify this specific germ and help the body get rid of the germ and get it out of the system completely. Um, so that's essentially how our immune system creates immunity to disease. Now, if you get it sick with a germ, like in this example, where there's a virus infecting the body and you're creating antibodies to it, then in those 2 weeks where you're getting developing immunity to it, that's when you usually are getting sick. You're going to have these symptoms of, the body's immune response with a fever, maybe a cough, maybe headaches and chills, feeling really tired and weak because you're using all this energy to fight off this infection, maybe diarrhea and vomiting. And sometimes even worse symptoms than that. But for most of these illnesses, after a week to 2 weeks, you're going to start feeling better because you finally have all those antibodies that are attacking that germ that has been replicating and spreading and making you worse and feeling more and more sick. And it's now able to turn the tide and destroy all those germs and kill them faster than they can replicate. Um, and then going forward, you your body remembers how to make those antibodies so that the next time that same germ you're exposed to that germ comes into contact with your body, you are able to attack it and destroy it right away. And you don't have to go through the process of getting sick again because your body already knows how to fight it. Now, there's variability in that. Some diseases are much better at evading the immune system. There's things like flu that change every year. There's other diseases that, for reasons we don't always understand, the body's immunity doesn't last quite as long. But in general, that's how it works. Um, so, given that knowledge, we can now talk about how a vaccine works in particular. It's the exact same process, but instead of exposing our bodies to a harmful germ that's going to make us sick and feel crummy, we expose our bodies to intentionally at a time of our choosing a known quantity of a known part of the germ. So instead of saying, okay, we're just going to hope we don't get sick and one day we might get exposed, definitely get exposed, and hopefully it won't be that bad and we'll see what happens. We say, okay, I'm going to get my appointment to get this vaccine and I know exactly what's in it. It's this small amount of antigen, antigen being a part of a germ that creates an antibody response. And then your body sees that antigen. It does the same thing. It launches a bunch of antibodies to try and find the right one to identify that antigen, that part of the germ, and get rid of it. But because this antigen is from a vaccine rather than a live virus or bacteria, it's not going to be spreading and replicating millions of times and trying to invade your whole body and make you sick. It just stays right in your arm or in your leg where it was injected, and while your body deals with it because it's inert, it doesn't do anything. Your body creates the same natural immune response. Um, so the most important difference there is that because we're not exposing our bodies to a dangerous pathogen with this vaccine, we don't have to deal with this sometimes very uncomfortable, sometimes dangerous, and sometimes deadly illness. We instead get this wonderful immune response that protects us from that illness in the future. Um, so that's really how every single vaccine works. It's just you expose yourself to a germ that you or a part of a germ that you know of that protects you from that live wild germ later. So next question to go over then is how do we create that vaccine from a germ? How do we get there? And again, it's the same mechanism with every single vaccine, but the way that we can create vaccines varies depending on the germ. There's a few different ways we've learned how to make a vaccine because different germs need different approaches to be most effective. Um, so one way that we can do that is we can take a germ and we can weaken it. We grow it in a culture in usually animal cells for several generations and weaken it so that it's no longer as good at at infecting humans until we have what's called a live attenuated virus vaccine, which means we take that wild type germ and we turn it into a cultivated germ that we know is not able to replicate in humans as well. Um, that examples of that are the MMR, varicella, rotavirus, and the nasal flu vaccine. A good way of thinking about this is the same thing as how we created dogs. We took wolves, which you don't want to be hanging out with, and they're very dangerous, and they will eat your baby if you get them near them. And we just domesticated them. We said, let's take the nicest wolves, let's train them up, let's breed the ones that are nicest. Let's give them lots of love and cuddles and attention. And thousands of generations later, we have the same species, but it's now our pets, and we have our chihuahuas we can just like let play with our babies, and we don't have to worry that they might nip once in a while, but they're no longer hunters, they're no longer predators. So it's the exact same process. We just do it on a small scale with germs, and use it to create immunity. Second way to do this, possibly the more simpler way, you just kill the germ completely, and you just expose the body to the dead germ. And then it looks exactly the same as it normally would, but it can't infect anyone. So you can create your immune response to it without having to worry about it replicate. So examples of this type of vaccine are the inactivated polio vaccine that we do in the United States, hepatitis A, the flu shot, and the rabies vaccine. Third type of vaccine is where we make a vaccine using only a part of a germ. So we can isolate in some instances only the part of the germ we need, just the antigen, and we take that only and use it to make an immune response. So then only that is in the vaccine, and your body sees that antigen without a whole live replicating germ, and it creates an immune response to that. So examples of that are the HPV, hepatitis B, shingles, DTaP, the pneumococcal vaccine, and the meningococcal vaccine. All of those are created by growing either just the protein or the whole virus and then isolating the protein. And then you just have that protein, the antigen, that goes into your body. The final way to make a vaccine, as of now, which is the newest way, which is mRNA vaccines. So I presume everyone's somewhat familiar with mRNA vaccines. They became very famous with the first ones that came out back in 2021, end of 2020, with the COVID vaccines. So mRNA vaccines, again, it works exactly the same way that any other vaccine works, in that you expose your body intentionally to the antigen you need to see to create the natural immune response to the disease. The difference here is it's your body that makes the antigen instead of the laboratory. So we are able to, instead of giving the body just the antigen, we give the body the mRNA, which is the ingredients to create the antigen. Your body sees that mRNA and it turns it into a protein, or rather translates it to make a protein, which is doing trillions, countless times every day for mRNA all over our body, for our mRNA, for other viruses and bacteria and other plant and animal and fungus DNA that's all over our body. It does it constantly. In this case, we're making it our bodies do that for the mRNA that we want it to for this particular antigen. And then once it does that, it creates these, in this case, the spike protein for the coronavirus, COVID-19 virus. And then our bodies recognize and destroy that. So same process, except that our bodies are performing the function of the lab and creating the antigen, rather than us having to grow a virus or a bacteria or a yeast and isolate that germ in a lab and then do the purification process to kill off all the extra virus and bacteria and any contaminants, anything like that. We just skip all that and let the body do the work for us by letting it translate the mRNA. So a little bit more complicated to understand, but much more simple to actually create, and is potentially going to open up the door to a lot more vaccines, because our bodies are very good at translating and getting rid of mRNA, and it potentially can lead to, in the future, hopefully, a lot more vaccines for diseases we will no longer have to worry about. So the other thing to say about this kind of vaccine technology is that even though it is the newest vaccine technology in a human vaccine, it's actually not very new. This technology has been in development since the 90s, mRNA technology, and it's already been used for successful cancer treatments and other medication uses. So this is just the first time we've been able to successfully create a vaccine with it. Um, and again, it's the reason this was the most popular and became the widely used COVID vaccine is because it's just the most straightforward to make. We were able to start creating this vaccine back in February 2020 when we had the genetic code for the virus. And everyone all over the world could then start working on this. We didn't need to actually have a germ. We just needed to know the genetic code, and then we could isolate the section that we need and create it. And that's why we were able to have a vaccine out by the end of the year, which is remarkable speed. And of course, there were other factors like someone finally caring enough to pay money to create medicines that we need, which doesn't always happen. So billions of dollars helped as well. Um, but that allowed this to be much more quickly created and tested than other COVID vaccines like the Novavax, which is also available now and is a more typical partial germ vaccine where they just isolate that protein and put it in the vaccine. So that's an overview of how we make vaccines, how we make different kinds of vaccines. The next question I think a lot of people have when I talk to them is how do we know that they're safe and effective? Um, a very important question. Before vaccines are developed, I think a lot of people are more familiar with this process now since COVID, but there's three phases of clinical trials that have to be undergone. First, there's preclinical trials and testing and safety data and animal trials. But then, with once all that is passed, we start phase one human trials with maybe a few dozen volunteers to make sure that it's safe, see if it seems to work, if there's any serious side effects, and try to gauge like what is, is there a difference between dose and side effect, all of that. Once that is established that things seem to work well, we don't have any red flags, we test it on a larger population of several hundred volunteers to make sure that we can more reliably know that it is working and have a better sense of any less common side effects, short-term side effects. And then finally into phase three trials, which is usually tens of thousands. It was 15 to 30,000 for things like HPV, meningococcus, and COVID vaccines of people to make sure that if there's any side effect that could occur, even like a 0.1% chance, 1 in 1,000 people might get it, we'll identify it with these trials. And once that's all done, the FDA reviews the data, and the people reviewing it are not employed by the FDA. They're independent researchers, university workers, practicing clinicians, who an important part of their job is reviewing this for the FDA. And then if based on their recommendation, the FDA will approve it. Afterwards, during and afterwards, there's ongoing monitoring of vaccines. We have to make sure that uh, yes, they test parts of each batch of vaccines that are made. They routinely inspect facilities to make sure that things are safe and effective in the manufacturing process, and that everything is continuing to run smoothly, which is unfortunately a lot more than is done for a lot of other medications, especially alternative medicines and supplements, which are not monitored by the FDA, and sometimes for our foods as well. Um, which is why with vaccines, we almost never have any serious safety issues, and there have been no recalls in any of our lifetimes. Whereas for foods, you may have heard there was a recall recently from, I don't want to say the wrong name, but it was some kind of deli meat that was recalled because it's causing illness in people across the country. And this unfortunately happens commonly because not everything is as well protected and monitored as vaccines are. Um, but with vaccines, we're able to more closely monitor them now more so than ever, thanks to the COVID pandemic, because during COVID, we developed even more monitoring systems than we already had. Um, and I list some of them here, but essentially we have active and passive monitoring and reportable monitoring. Anyone can report any kind of side effect from vaccines. There's also hospitals that routinely collect actively the data for any kind of vaccine side effects and possible side effects. So we have a very good collection of information about what is happening to people after they get vaccinated. Most of the data collected is nothing to do with vaccines. And if you go to something like VAERS, Vaccine Adverse Event Reporting System, which you'll hear commonly about if you look into any kind of anti-vaccine propaganda, they talk about it all the time. It lists all sorts of terrible things happening to people after getting vaccinated. But if you read about it, you'll see, oh, well, this person got in a car crash, this person got struck by lightning, this person so there's reports of someone growing a third arm because anyone can report anything. So there's literally nonsense in there. But most of the stuff on there has nothing to do with the vaccine. And theirs is allows us though to see if there is anything happening at a higher rate than we would expect. And it is how we identified, for example, with the prior rotavirus vaccine from a few decades ago, it caused a dangerous condition in kids called intussusception at the same rate that the rotavirus disease did. And we said, well, this isn't really useful, so we should just make a better one. And we immediately said, let's stop using this. And we made a better one. And then we looked for that side effect with the new rotavirus vaccine and found it doesn't actually happen anymore, which is great. So now we have a better vaccine. VAERS is also how we identified the rare side effect of heart inflammation with the COVID vaccine. And we identified that within a few weeks of it becoming, of it starting to show up in the younger population of vaccinated kids, adolescents. And that's how quickly this works. Within a matter of weeks, we were able to identify this side effect that happens in a dozen cases per million. So extremely rare. And even so, we were able to find it. So it's very good at finding even the most rare side effects. Um, so that's kind of a very broad overview of how we monitor safety, and I'll touch more on those side effects in a moment. But I first want to just cover another common question that I get from parents is, I think it's just about the money, like these pharmaceutical companies, they're just trying to make money off of us, or the healthcare or government just trying to make money. And I mean, on the one hand, that's true. We have a for-profit healthcare system, so everyone needs to make money to live, or we don't have houses or food. And because of that, yeah, everyone's going to be trying to make money. But vaccines are not a money maker in general. In my clinic, we make more money on visits where we don't vaccinate because the vaccination system here is awful and we don't get reimbursed nearly as much in Oregon as we need to for the cost of storing and administering vaccines. So we actually sometimes lose money or definitely make less, and we would be more profitable if we weren't giving vaccines. And some clinics here don't give vaccines because it's unaffordable to do so. And part of that is good because it means it's available to parents for free, which it should be. But unfortunately, there's no one paying us, which there should be. But an example of why why vaccination is not a moneymaker is this story I'll share here, which is that in 2021, the second half of 2021, June and November, there were in the US, we documented 1 million people who were unvaccinated who were hospitalized with COVID-19. And was a really good study out of, I think it was Hopkins, and they calculated if all million of those people had been vaccinated, then we would have seen about 130,000 of them might have died anyway from hospitalization, and about 3,000 of those million would have died anyway from COVID. So, and that whole process would have cost us about $150 million to vaccinate all million people because the vaccine was about 150 total. So that would have been $150 million going to the pharmaceutical company, more or less, and we would have, seen about 130,000 hospitalizations, 3,000 deaths, despite having vaccinated all those people. But we didn't vaccinate those million people; they were unvaccinated, and so what actually happened was we spent $13.8 billion in healthcare costs. And that's money that went to the pharmaceutical companies and the hospitals and healthcare. And that money was subsidized by increased insurance and Medicare and Medicaid costs for all of us who pay into those systems and pay into our health insurance. And it was about 92 times more money than it would have cost to just vaccinate everyone. And what we saw was instead of only 130,000 people being hospitalized, 832,000 people because of COVID. And instead of 3,000 people dying of COVID, it was 98,000 people dying of COVID because as you saw in the graph I showed earlier, if you don't have the vaccine, you're much more likely to die from that infection. So this actually made a lot more money for the healthcare and pharmaceutical system than would have been made if all of those million people had gotten the vaccine instead. So it's certainly not profitable to vaccinate compared to just treating illness. Um, so moving on, talking about vaccine ingredients, and then we'll go over side effects. Vaccine ingredients are pretty much the same for all all vaccines in a broad sense. You have the antigen, the part of the germ that you want to create immunity to. You have the any kind of preservative to make sure that it's going to be stable for transport, stable in the fridge, and that it's going to work when you get it, and that it doesn't get contaminated with any kind of infection or a germ rather, so you can get it safely. And then you have any kind of stabilizer or buffer needed to make sure that you can that it stays suspended in solution or in a powder that it as it needs to before we actually deliver it. Um, and then you might have what's called adjuvants, things that allow you to have a better vaccine response or to have fewer side effects and to use less antigen. So the example I'll share today is the COVID vaccine. These are the Pfizer and Moderna vaccines. Again, I mentioned there's a couple others like Novavax, but these ones, the active ingredient is the mRNA. Now, that's not the actual antigen, but it's what our body uses to create the antigen. And then there's the lipid envelope. So it's just an envelope of fat, just like all of the cells in our bodies have. So that holds the mRNA together till our body can open it up and read the mRNA. And then just some salt, sugars, and buffers that allow it to, as I said, stay stable and preserved so it doesn't get contaminated and so it's stable through and works when we put it into our bodies after transport and storage. And that's it. Those are the only ingredients in the vaccine. And these last two are foods. This is fat, sugar, and water. Like these are foods. And this is true for every other vaccine. All of the things that are in it besides the germ are things that we're going to be finding in our foods, our drink, and our air, and be exposed to regardless. And they're in much smaller doses than we're normally exposed to. So that's vaccine ingredients. And again, other vaccines like hepatitis B, they'll have a hepatitis B antibody or germ instead. And some like that one or others might have an adjuvant like aluminum. But it's, again, everything other than the germ is something you already have in your body. And that's why these ingredients are chosen, because we want ingredients that we know our body can deal with. Um, and I should also add that the antigen itself is something that our body is also exposed to already, because we're exposed to all these germs, whether we like it or not. And when we are exposed to those germs, we get exposed to these same antigens that are in the vaccines. So the difference is we get exposed to a lot more of those antigens because those germs are replicating in our body. Um, Going into a few specific ingredients I get questions about. A lot of people have concerns about heavy metals in vaccines, and they talk about aluminum. First thing first, aluminum's not a heavy metal. It's a light metal, and it's also the third most common metal in Earth's crust. And it's in everything. It's in formula and breast milk. If you're giving your baby breast milk or formula, you're giving them more aluminum every day than they're going to be getting in any vaccine. And this graph shows the first 6 months of life, how much aluminum you'll get from all the vaccines in at that time compared to someone who is breastfed or someone who's formula fed. So and this is not a bad thing. It's fine. Aluminum is not dangerous. We know how to process it. Otherwise, we wouldn't be able to survive on Earth because, as I said, it's in the crust. So it's not dangerous. It's not a heavy metal, and we know how to process it. We get rid of it immediately. And if you measure a kiddo's aluminum level before and after a vaccine, you wouldn't even be able to detect a difference. Now, the other concern about heavy metals is mercury, which is a heavy metal. But again, this is an example of using a word that sounds scary to just make people scared about something that's not dangerous. Heavy metals aren't inherently bad. Now, mercury can be quite dangerous, and hopefully everyone is aware that it's not a good idea to get exposed to too much mercury in food, especially while pregnant, which is why it's recommended that pregnant people specifically limit how much fish they eat from high mercury containing fish. Those are fish higher in the food chain, like tuna and shark, if anyone eats shark. Um, but the important thing to know first is that the amount of mercury in a flu vaccine, which is really the only vaccine a child might get if they get multi-dose flu, is the only vaccine they would get that has mercury in it. Everything else doesn't anymore. That is about half as much as what you would find in one can of tuna. So again, you're getting more of this in your food than you are from a vaccine. Secondly, the mercury in vaccines comes from thimerosal, and that breaks down into what's called ethyl mercury, which is very, very different from the mercury in foods and fish, which is called methyl mercury. Ethyl mercury is not dangerous. Our body can process and eliminate that very quickly. Methyl mercury, on the other hand, it cannot, and it builds up in the body a lot more. May seem like a small difference, but it's entirely different elements or molecules, rather. It's the difference between ethanol and methanol. One you would drink at a party or for fun, and the other is antifreeze, and you would die if you drank it. And it's just the difference of one letter, but it's a completely different substance. Same kind of thing here. Last important ingredient to cover, formaldehyde, which a lot of people I find have concerns about. Oh, there's some formaldehyde in vaccines. And again, it's one of those things that we might associate with being bad for us because we think about embalming bodies with formaldehyde. And yeah, if you were to drink or breathe a huge amount of formaldehyde, like that wouldn't be great for you. But vaccines have a very small amount of formaldehyde. Some of them do. They have trace amounts because it's used in the purification process for some vaccines that you have to actually grow in culture, and you can't completely eliminate it. But you're going to have 10 times as much of that formaldehyde in your body at any given time because it's a natural byproduct of your cell metabolism. Cells create formaldehyde and process it naturally. And as you can see here, if you eat a pear, you're going to get 60 times as much formaldehyde as you'd get from your vaccines. And this is all vaccines you would get in the first like 2 years. Um, so again, just helpful to have perspective there about the differences we're talking about. Okay, and then last kind of question to just drive this point home is what is the idea of what we call chemophobia. People who are or not really people, but our collective natural tendency to be afraid of chemicals or in general things we're not familiar with or we don't understand or that are foreign to us. And this is an example. This is an ingredient list for a common food. And the question I ask everyone is like, would you eat this? It's got all these things that maybe not everyone recognizes. There's fructose and sucrose and maltose. There's arginine, aspartic acid, threonine, tyrosine, stearic acid, a lot of acids. There's all these colors and flavors in it. And it's a huge list. Like, who would want to eat something with this many ingredients? But this is just a chemical ingredient list for a banana. And I presume we've all eaten bananas. And the point here is that just because anyone can make something sound scary by putting it in language that we're not as familiar with or breaking it down into ridiculous levels or omitting key pieces of information. But if we take the time to understand it, you don't necessarily need to be worried about it. So bottom line with ingredients, they're safe. Vaccines only use the ingredients that are necessary to protect us from disease. They don't have any extra ingredients. So why would they? It'd be a waste. We use literally the smallest amount of every single ingredient and the smallest number of ingredients and the simplest ingredients that are possible to create the vaccines. They're much more streamlined and safe and monitored than any other medicine we take. Definitely than anything that you get at a supplement store or a vitamin shop or over the counter like nutrition supplements, because those are in a whole separate category for medications, not monitored almost at all, and definitely more than the foods we put in our body. And other than the antigen, which we're going to be exposed to throughout our lives anyway, all the other vaccine ingredients that are in any vaccine are found commonly in the foods and drinks and household products we're exposed to every day. Okay, moving on to antigens. A lot of people will wonder, okay, what about the antigens in vaccines? Like I feel like this is too many antigens. Can we really take it? And you might not get the right numbers, but hopefully you will. A lot of people will say, well, you have a bunch of antigens in your vaccines, a couple hundred. The actual number is 161 right now by the age of 11. You'd be recommended to get exposed to 161 antigens from vaccines, and you'll get protection from 17 diseases. So that might sound like a lot, like 160, man, that's a big number, but it's not really, because in 1960, by the age of 2, we all had 3,000 antigens in vaccines, and we could only protect from 5 diseases with all those antigens. So we have an order of magnitude fewer antigens and 3 times more diseases that we are safe from because of vaccines. Now, 3,000 might also sound like a big number, but it's still not, because even in 1960, that was a huge benefit, because the fuller picture is that in our environment every day, we're exposed to thousands of antigens. So by the time your kiddo is 4 years old, they've been exposed to 3 to 8 million different antigens. So, and they're fine, obviously, because all of us these days, hopefully, almost all of us, we make it to age 4, which is not really the case back in the 1900s before vaccines. And so we know how to deal with these antigens. And if we couldn't, we wouldn't be able to survive on this planet. They're everywhere. Vaccines represent less than a drop in the bucket of how much antigen we're exposed to. And of course, they reduce how much antigen we have to be exposed to, because then when you get sick, your body is able to kill a germ before it can replicate and create more of itself. So now on to side effects, what you can expect when you get a vaccine. Side effects are pretty similar for all vaccines. There's some differences. But for every vaccine, the most common side effect is that people are going to feel fine. They'll have Probably nothing. Maybe, you'll have pain from the needle. You may have like some redness or swelling or itching, maybe some localized symptoms that's pretty mild and goes away pretty quickly. And that's most common. Less commonly, you might have more significant swelling and pain that lasts a little longer. You might have fatigue or headache, fevers, rashes sometimes with some vaccines, maybe chills or body aches. Some people will feel really tired and weak after, especially things like maybe flu or COVID vaccines, or the measles vaccine or chickenpox vaccine might cause a rash sometimes. Again, those are less common, but they'll happen every few dozen cases or so, and they'll usually come on within a couple of days, maybe a week later, but that would be less likely, and usually go away within a few days, and again maybe last up to a week, but that's pretty uncommon. So that's really it. Those are the most common side effects that you'll get from a vaccine. So if we compare that, the mistake I find a lot of people making is like, well, I don't want any of those side effects. They sound terrible. It's like, and I would agree, like they're not great, but when you're deciding whether or not to vaccinate, you're not deciding whether to get vaccine side effects or have no side effects. You're deciding whether to risk vaccine side effects or risk getting infected with the germ that you're not protecting yourself against. So if you look at the full picture, you really have to compare what your actual odds are of getting any of these symptoms. And so if we look at the example of COVID again, if we were to take 10,000 people and vaccinate them against COVID, then these bars in blue represent how many people would have different side effects. You'd have about half of them would have maybe headache, fatigue, muscle aches, joint pain. And this, I should say, is for adults. For kids, these numbers would actually be a bit lower. Kids will often have fewer side effects for all of these things. Um, and then if you notice, if you take instead another group of 10,000 people and they don't get the vaccine and they just get infected without having been vaccinated, then their symptoms are shown in red. And you can see that any side effect that the vaccine will cause, the infection is at least as likely, really more likely to cause. But in addition, the infection can cause things like shortness of breath, long COVID, which is awful. I've had patients have been coughing or weak or lost their sense of smell for 2 years. And then, of course, getting other people sick, which a vaccine will not allow you to do, but an infection definitely will. So those are the important differences. Um, one other important note, and the other thing I'll say is this is true for every vaccine. Again, these specific numbers are examples for COVID, but any vaccine you look at, the side effects it can cause are going to be the same ones you would see from the infection, except less severe, and they're going to be less likely to happen compared to if you were to get an infection. And if we were going to look at an important example of one of the worst side effects of the COVID vaccine, this is the heart inflammation I mentioned earlier that we identified pretty early on thanks to the VAERS system. Um, so this is called myocarditis, which is literally just Latin for heart inflammation, and we know that it happens in about 0.7, less than one person per 10,000. And that is for adolescent boys in particular. For girls, it's less likely. For people outside that age range, it's much less likely. So this is the people who are most at risk of getting heart inflammation from the vaccine. It's less than 1 per 10,000. So less than a 0.01% chance of getting it. On the other hand, if those same kiddos, those 10,000 kids were to get COVID instead and not get infected or not get vaccinated, then almost 5 of them would get sick with myocarditis. So 5 times as many, or yeah, 5 times as many, more than 5 times as many people would get sick from would get myocarditis from the infection than from the vaccine. So again, you're still much safer with the vaccine than with the infection. And also, myocarditis from the COVID vaccine is not dangerous. It's scary for sure, but it's not dangerous. People recover from it within days. Even the worst cases, they'll get better within a few days and complete return to normal heart function. As opposed to if you get it from the virus, it's not always the case. It can be much worse. So even with these very scary side effects that are very rare, they're still more common if you don't get the vaccine. And then, of course, there's some side effects that you won't get from a vaccine, but that can be caused by an infection. And again, I'm taking an example of COVID, but this is true for all other vaccine preventable diseases. No vaccine will cause you to be admitted to the ICU or to have a stroke or to die. Like it just doesn't happen. But you will be admitted to the ICU, or you could have a stroke, you could die if you get infected with a vaccine preventable disease. These are the rates for COVID. Now, these rates are probably a little lower now, hopefully, because this is from a couple years ago, and now we have lower rates and better medicines. But it's still not zero. There's still deaths from COVID this year, and there's still hospitalizations from it. So there are things that the infection can cause that the vaccine just can't. Another example, measles. I mean, that can cause immune amnesia, so you'll get sick for years afterwards, much more than you would otherwise. Something that you wouldn't have to deal with the vaccine. Um, so that's kind of common and rare side effects. Long-term side effects is also nothing that I worry about, but something that I think a lot of parents have questions about. First off, I mean, we have decades of data for every vaccine pretty much except COVID at this point. But even with COVID, we have more than enough data to know that long-term side effects aren't really going to be an issue. And so this is how I know that and why I don't worry about it. One, in the history of all vaccines ever made, we have only ever seen vaccine side effects occur within 2 months of getting the vaccine. If it doesn't happen then, it's not going to happen. Usually it's within a couple of weeks or even within a couple of days. And two, everything that's in a vaccine is eliminated from the body within a few weeks of being vaccinated. So there's nothing that lingers to cause any problems. The only difference in your body afterwards is you now have your body's natural immune antibodies that it's created. And if those are going to cause problems, then they're going to cause the same problems if you create them from an infection as they would if you can get it from a vaccine. So it's just from a physiologic and biologic standpoint, just not possible to have any kind of long-term side effect that we wouldn't have already found out about and that wouldn't have already shown up. So, who should not get a vaccine? It's a very small list. There's a lot of people who worry that maybe they shouldn't because of specific conditions or family history and things. And it's important to have a frank discussion about that with your healthcare provider. But there's really only a few reasons you definitely don't want to have a vaccine or you should avoid a vaccine. And that's one is if you've had a severe reaction to a previous dose. And severe means like an immediate anaphylactic, like severe allergic reaction. If you've had that, then yeah, you wouldn't want to get that vaccine again. It does not mean don't get other vaccines. Vaccine ingredients, although there's the same type in every vaccine, they're different in each vaccine. And so being allergic to one vaccine does not say anything about being allergic to a different vaccine. So if you have a bad reaction to one, don't get that one in the future, but you still should and are able to safely get the others. If you have a severe allergy to a component of a vaccine, same kind of thing, then don't get the vaccine. Or if you're severely immunocompromised or pregnant, then you don't want to get a live vaccine at that time. Those are like MMR and varicella, because as I said, those vaccines are still live viruses. They can replicate a little bit, and that's going to be fine for someone with a working immune system. But for someone who's a little immunocompromised, not necessarily the safest idea and not recommended to get. Um, to be honest, it's probably fine to do in pregnancy, but it's not recommended, and I would never recommend it because we don't actually have data to prove it, and no one wants to do that study and we shouldn't because it's not worthwhile. We can get it before and afterwards, and we can vaccinate our kiddos. But because of the theoretical risk, that's why we don't recommend it in pregnancy. And I do want to emphasize, don't get those in pregnancy. I'm not recommending getting them. I'm just saying it's based on theoretical data. But if you are pregnant, there are vaccines you definitely are recommended to get. That would be the pertussis, flu, and COVID vaccines. And this graph shows why. It shows that this shows the risk of a newborn in the first 6 months of life being hospitalized with, on the left, COVID, in the middle, flu, or on the right, pertussis, in their first 6 months of life, depending on whether or not their parent was vaccinated or not against the disease. So you can see if you've gotten a vaccine for COVID during your pregnancy, then you have a significantly reduced risk, about 61% reduced risk. Your baby has a 61% reduced risk of getting COVID in their first 6 months of life. If you're vaccinated for flu during your pregnancy, your baby gets those antibodies and they have an 81% reduced risk of getting flu in their first 6 months of life. And if you get your pertussis vaccine during pregnancy, then your baby has a 38% reduced risk of being hospitalized in those first 6 months. So it's one of the best ways you can protect your baby is giving them more antigens straight from their parent. And then to close out here, the one of the last images I wanted to share. This is from some of our videos we have on our website, boostoregon.org. They're really great, fun cartoons, great for kids and adults. And I like them a lot. And this shows that when it comes to vaccines, more vaccines means less medical intervention. So this little character here is our immune system. On the left, this guy wasn't vaccinated. On the right, he was vaccinated. And you can see his little vaccine coach there cheering him on. They both had to fight this infection. In this case, I think it was streptococcus or pneumococcus, I should say. And this guy who wasn't vaccinated, like, he didn't die. As I said, we don't really die from anymore. He survived the infection, but he needed a lot of antibiotics. He needed steroids. The kiddo might have needed to be hospitalized or intubated in that time. So it was a lot of harm that was done and a lot of medication and intervention that was done to beat this disease. But on the right hand side, this immune system had their vaccine and they were totally protected and they knocked this disease out before even getting sick. So this kiddo wouldn't have even noticed that they were exposed because their body took care of it before they started showing symptoms. So this shows not only the importance of, like, it doesn't really, we're not talking about preventing death necessarily, although vaccines prevent lots of deaths in other countries. We're talking about preventing excess and unnecessary medical intervention and excess and unnecessary illness and suffering. Because even the most mild illness is, I mean, any of you who are parents know, every illness sucks. Like your kid gets a minor cold, it still sucks. You're up for all night and you have to miss school and you might have to miss work. It's awful. And these can be much worse than minor colds. And then the reason I vaccinated myself, this is a picture of my baby. She's 3 now, but this is still one of my favorite pictures. This is when she first met her grandma, who we visited down in Texas on her 84th birthday. And we made sure that she was fully vaccinated before we went and that my grandma was fully vaccinated because I wanted to protect not only my baby, but also my grandmother, because this was the latter end of COVID. So we were still worried about that. And we made sure she got her vaccine before we went to see her. Because I wanted to make sure I wasn't taking any unnecessary risks and protecting the people I love as much as I could. And the other reason also is because I want to teach my baby that, like, it's not just about protecting her, but about protecting our whole community. And that because I want her to grow up to care about other people, not just herself. And if she's going to do that, then I have to be a role model for that. So those are the reasons why I got my baby vaccinated. Well, some of the reasons why I got her vaccinated. Um, and yeah, I hope that resonates with some of you. But that's really, it's just about protecting not just you and your own family, but your extended family, your neighbors, and your whole community. All right, so that is my whole talk. If there anyone who has questions, I'm happy to take them. I do have a long list of references if anyone is interested in those. And here's more here.
All
But yeah,
right.
I hope that was helpful.
Thank you so much, Dr. Hassan. We do have a handful of questions that have come in. I'm just going to throw my slide up again on the screen. If you don't mind, I will share.
Oh yeah. Here we go.
Wonderful. All right. So I have the QR code. If anyone can scan that and take the evaluation survey, that would be great while we move into questions. And okay, first one, let's see, there's a handful, there's like 7. We might not get to all of them, but maybe I can email them to you and you can maybe provide some feedback and I can email that out. Okay.
Sure. Yeah. And if anyone else does have questions, they can feel free to reach out. I'm just at Ryan@boostoregon.org, or you can reach us on our website. I'm happy to,
Sure.
that's what we do. We answer questions.
Yeah. Okay. So from Brendan, are you familiar with the next generation vaccines, including mucosal vaccines, which trigger IgA and T cell creating mucosal immunity? He asked because BARDA had came to soliciting oral formulations for COVID-19. And she says, I don't know much about this, but saw it this morning, so thought I would ask. And could you elaborate on how they work?
I cannot. No, I have not actually heard of that. So I'll have to look into it. Thank you for bringing it to my attention. I will say generally oral vaccines would be way better. I think if all our vaccines were oral, like a lot more people would get it. I don't think it's a stated reason, but a lot of people are hesitant because of just needles. Like if it weren't a needle, we wouldn't care. We put all sorts of things in our mouths that are much less safe. So I would love that. But the reason there aren't a lot of oral formulations because that IgA immunity is not as effective in protecting with our what we need, which is the IgM, IgG immunity. So I'd be very interested. I'll see if I can find more about that, and I'll tell you what I find. That'll be interesting. Maybe I'll write a blog post about it on our website.
Awesome, thank you. And Elizabeth, why she has a question about why does the mRNA COVID vaccine only last 3 to 6 months? And then she also added, or why doesn't our body continue to make the spike protein? So those two questions.
Yeah. So um, so a couple things. The mRNA vaccine, it's not like it lasts a certain amount of time. It's your immune response will fluctuate over time, and with different vaccines that varies. And there's different kinds of immunity. So if you have gotten a series of COVID, the primary series of COVID vaccines, you have really good long-term protection against severe disease. We've established so far that it seems to last years, um, but it's that protection from more mild disease, which is mediated a little bit differently by having more active antibodies ready rather than those long-term memory cells. Rather than T cells, I think. I'd have to review the pharmacokinetics again, but it's uh it's that short-term immunity that wanes, or that immediate immunity that wanes in the short term for about 3 to 6 months. So that's the main thing. So if you never get a booster for the vaccine and you just got the primary series, you would still have pretty good protection against having a hospitalization or or being or dying because of COVID. But it's those more minor infections that you're getting better protection against because you need a more ready supply of antibodies for COVID to do that. And that does seem to wane. And then the other difference, of course, is that with COVID, that is with, every variant is slightly different. And so that really robust protection against kind of any disease, it's not going to be as good when the vaccine mutates and the variant's slightly different, and it can kind of bypass some of that initial defense. So I think that's the best I could answer it in a short time, but it does vary per disease. And like some vaccine protection lasts forever, like chickenpox or measles, but others like pertussis, it will wane more quickly. And that has to do with the nature of the disease and also aspects of how long certain antibodies are effective that we don't really fully understand yet.
Okay, thank you for that. The next one talks about, aren't there connections to the COVID vaccine with people developing blood clots? Could you expand on that?
Yeah, and actually, first, I forgot to answer the second part of Elizabeth Sam's
Oh,
question, which
yes.
is we don't continue to make the spike protein because that mRNA is destroyed. So everything in the vaccine I mentioned is gotten rid of within a couple of weeks. So that mRNA is translated several times, but then it's degraded and recycled by the body. So we no longer have that to continue making the spike protein, which is good because if we did, we'd keep getting that, those vaccine reactions of like the inflammation and the immune response. Um, Yes, and then going on to the next question. Yeah, so the COVID vaccine, I didn't mention the blood clotting, but because it's not really relevant anymore, that was a side effect with the Johnson and Johnson vaccine, and it's not actually recommended anymore for that reason. That was also found very quickly thanks to VAERS. It was, if I remember, it's a long time ago now. It seems like another life. It was stopped. We didn't recommend it for a while we investigated that. And then we said, okay, yes, there's a link. It's very rare, especially in women, I think 30s to 40s or so. And so, but it's still better than no vaccine. So it's recommended and available, but this is a side effect that you may want to avoid by getting the different vaccine. Eventually, when the mRNA vaccines became more available, where they just said, well, there's no reason to have the J&J one anymore because it does have this blood clot condition that even though it's rare, it is dangerous and unnecessary because we have this better version that doesn't cause that. But yeah, the mRNA vaccines, they don't cause blood clots.
Okay. All right. Next, do you think the vaccine fear hesitancy is related to the newer way the COVID vaccine was created, or has there always been fear hesitancy and it just wasn't publicized like as much?
Yeah, it's certainly both. There's a lot of hesitancy because of the nature of the pandemic, because of the nature of the vaccine being different and made of mRNA, which is a little more complicated, not well understood. It's a whole new avenue of attack for anti-vaccine propaganda to say, oh, well, these are all the things mRNA can do, and there's so many more unknowns that people can capitalize on to exploit people's fears. So it's definitely a big player, but also, yeah, there's always been hesitancy. Ben Franklin was very much opposed to smallpox inoculation, and then his son died of it, and he was like, "Oh, actually, we should do this," and he regretted that later. And that, unfortunately, is what continues to happen throughout all of human history, where there's always been anti-vaccine propaganda and fear about it, and people who have exploited that for money. But with the pandemic, that definitely ramped up exponentially. Profits of anti-vaccine charities, quote unquote, like Children's Defense Fund is an example, and like a bunch of medical freedom organizations. Those ramped up, they like doubled or tripled in the first years of the pandemic, and probably went a lot more since I haven't checked, but they made so much more money because this was a huge way for them to tie in, bring a much bigger gathering to kind of to exploit so much more fear that was going on then. And I had a lot of patients who previously vaccinated everything, and then after COVID gave me all these reasons. Well, now we don't trust anything, and we don't want to do it anymore. We're worried about it. And they also did a great job of capitalizing on political division and ideology, and that played into it a lot. So now there's a lot more ingrained ideological beliefs about vaccines as well, which has been challenging. So a lot of those things have kind of been new challenges related to the pandemic.
Okay, and two more questions. Are physicians paid a bonus when they reach a certain percentage of vaccinations of their patients set by an outside agency? Are you aware of that?
Yeah, kind of. So that varies. There's so there's the system is way too complicated and dumb. What it should be, in my opinion, is we just need to be paid to do good medicine and given money to not even given money, given the vaccines for free, so we can give them to patients for free and reimbursed for the work that we do. That would be great, but we don't have that. Instead, we have a multi-tiered system where we have vaccines for children and then private insurance vaccines we have to keep separate and a whole supply. And bottom line is a lot of clinics will lose money or make small amounts of money from vaccines, which is why a lot can't. There are bonuses that like incentive metrics, which is part of an extension of the Affordable Care Act. So the idea is we want to not do treatment-based care but value-based care. So instead of getting paid more money for giving a bunch of antibiotics for ear infections or treating measles, I should get more money for preventing measles in the first place, for keeping people healthy, keeping people out of the ER and from getting diabetes. But that's not what happens. The ER docs make way more money than me, who I'm trying to prevent stuff, and they're treating it once it's already happened, and they're the ones who make more money. Not that that's anything wrong with them making money, but the idea is that we pay for outcomes. So we're trying to shift to paying for value, and that's part of what this metric like this and others are. Is if you have a certain percentage of your population vaccinated, then you will reach this metric, and that can give it's not like straight money to you, but it's part of a system of metrics that can increase the overall clinic revenue. It's really only specifically for CCOs like Care Oregon, not necessarily for all private insurers. Different private insurers will have different policies on that. Again, that could be like an hour or two talk, but bottom line is, yeah, you might make some from certain insurers, not from all. But overall, as a clinic, it doesn't make up for the discrepancy in what you'll make for vaccines. And in general, a lot of us would be more profitable without having to pay for vaccine administration.
Okay, thank you for that. And the last question from Brendan, correct me if I'm wrong, but aren't you still getting infected with the virus even if you get the COVID vaccine? It may be less severe, but you're still getting infected, correct?
So you're going to be exposed to a germ regardless of being vaccinated. We can't really stop exposure. We can reduce it by measures like hand washing and masking and staying home and things we did in the pandemic and all of that, but being exposed you can't fully prevent. The vaccine will allow you to have the antibodies ready to fight the disease so that when that germ gets into your body you're immediately fighting it off. Um, so it depends on kind of how you would define infection. I usually think of it as like once the germ has started replicating actively in your body and started causing symptoms, that's when I think of you being infected. So a lot of times you're not going to, this is with all vaccines, you're not going to get infected because as soon as the germ comes in, it gets destroyed before it can take hold and cause an infection. But in some cases, you will still get, be exposed enough, or your immune response won't be quite ready enough to prevent infection entirely. So you might still get sick and you'll have some symptoms, but you still have that head start. So with all the antibodies from that immunity you already have, so you're going to be less sick than you would otherwise. So if you have two identical situations, one universe someone gets the vaccine and the other universe someone doesn't, and then they both get sneezed on by the same person at the same time in the same place, they might both get sick, but the one person is without the vaccine is definitely going to get more sick than the one without, because they don't have as much protection. But so yeah, I hope that answers the question, and that's true for most vaccines, not all. Like MMR, 99% chance you won't get sick. Flu, like maybe 85%. So it varies.
Wonderful. Thank you so much for asking these questions and having this discussion. And thank you, Dr. Hassan, for presenting. We really appreciate you being with us today. And I really loved your examples. They really resonated with me, and
Well,
I'm
thanks
sure
so much
with
for having
others.
me.
Yeah. So thank you to everyone else who could attend, and to stay connected with us. You can follow Healthy Nodak on Facebook, Instagram, Twitter, and Foundation for Healthy North Dakota on LinkedIn. Also, to join the coalition, visit the link to stay aware of future webinars and updates on the foundation. And here's another chance to scan the QR code to take the evaluation before it's sent out via email. So thanks again, everyone, and enjoy your day.
Bye, everyone.